Hello everyone, TFCom here, and I'm going to be doing something a little different this time. I'm going to teach you how to give an intramuscular shot. It can be any intramuscular shot. Insulin sometimes is, let's see, there's testosterone of course, a lot of other medical conditions and stuff that need intramuscular shots. I'm particularly going to do testosterone. So I'm going to tell you what you need first. First, you need a Sharps waist bin. This is the only brand I could find, and it is from Walgreens. It's a complete needle collection. It was $7, I think. It was pretty pricey, but it's required by law, at least in the United States. And then you seal it after you're done, of course, and you return it. They usually ship it to a special disposal place, all their stuff. Basically, they do it for the citizens' health. They don't want any garbage man getting pricked with a needle or something. So, I guess that's it. And, you know, they don't want them to get AIDS or any weird thing. So, then you need, of course, a sterile needle. Got mine from Walgreens too. You'd open them up. Usually they do not recommend needles like this, but it is all they are selling in my town, so I really don't have a choice in the matter, unfortunately. Usually they recommend you screw off, you take off this end, and you put on one that's super thick, and that's how you'll draw the liquid out. And then you screw this end back on to actually inject it. But I don't have the thick one, which is okay. It's not going to kill me. So then, of course, you need your medication. And you need at least one alcohol swab, or I guess regular alcohol with a cotton ball can work too. And a Band-Aid. I use latex-free because I'm allergic to latex. Some people choose to use gloves. It's not necessarily needed. Okay, another important one is, as you can see, either wear shorts or take off your pants for this one. You'll probably be in the privacy of your room, so you're okay. But it will be going pretty high up on your leg, and pants cannot roll that high. You can roll up your boxers even, some people have to do. So, now I'm going to teach you how to get the liquid out of the container. They're usually pretty tiny little things. This is 10 milliliters, and this is the largest they had. Most of them were 5. But actually, no, I think most of them were 2 milliliters. Like, they were itty bitty. It's the largest I could find. So that. And everyone's container will say a certain thing. Instructions. Mine says inject 1.2 milliliters into the muscle once every 2 weeks. You could be 5 milliliters every 7 weeks. I don't know. Whatever is your thing. Could be every day. Or after every meal, or whatever your instructions say. Do not use my instructions as a full thing. Now, first thing you need to do is uncap your needle. If you have a bigger one, switch to the bigger needle. And pull back however much you need. But fill it with air instead. So I need 1.2. I'll fill air all the way to the 1.2 mark. Get your thing, put it upside down, and put the needle in. Shoot all of that air inside. It will create a suction. Sometimes it takes a few tries, especially if the liquid is not 100% full, which is why the smaller ones do help, but they cost a lot more because of more packaging and such. In fact, my insurance will cover the large one, and I had to pay $44 out of pocket though. But the small ones, I would have to pay like $500 out of pocket. So I stuck with big. Next thing is, most intramuscular shots, the liquid is very, very, very thick. So it is very difficult to pull it down. It's a game I like to play, a bouncing game. You pull, and bounce back up, pull, bounce back up, pull, bounce back up. And basically you just keep doing that. I pull all the way to where it needs to be, let it go, pull, let it go, pull, let it go. And as it bounces up, it slowly, a little liquid will trickle in. And eventually you'll get to however much you need. This is only a 3 milliliter one. If you need to take more than 3 milliliters, then you can get a larger needle probably. If you cannot, then I guess you could take 2 shots. I mean, however much you like your needles. I really don't like needles that much, and it costs more because you have to pay to throw away your needles. Each needle, though, is 10 cents, I believe. At least at Walgreens it is. So it's not a complete waste of money to do that. Like, it's not like an insanely expensive thing. So this does take a long time, especially if you're learning. You can wiggle a needle around, try to get it right on the liquid if that helps you, if you're low. And eventually, after doing this for quite a few minutes, you will get exactly how much you need. Eventually. I'm doing this real time with you to show you just how long it takes. Okay, I'm almost there. Okay. So I've reached my point. Then you put it back upside down. I mean the right side up, you know. Pull the needle out slowly. And now you have your needle. Pull back one more line, but with air. This is important to keep basically your blood vessels from exploding. Recommend immediately putting up your liquid so you do not lose it. Thing I'd like to show people, mine was already opened, but most liquid does come like this, and it's very, very hard to rip off the brown part, but once it rips off, then you can do it. It's very, very difficult, believe me on that. Takes a bit of strength, and you're worried you're going to break it. But okay, so it's all packed up. Put it away. I do not need it at this moment. Okay. Next thing, hold your needle up. Lightly smack it with your finger until all bubbles are gone. I don't really have much bubbles in mine. I think they're already gone. Okay, cool. Some people, you see it's pretty clear. Some people get big bubbles all around, like it looks like a peroxide type thing. So then you put your needle down. Make sure it's capped so you do not step on it or anything. If it doesn't come with a cap, please be careful. Some of these needles are half this size, some are like twice this size, whatever. This is mine. Oh, and if you used a bigger needle, if it came with it or such, then you would screw on your new smaller needle and immediately deposit the bigger needle into your waistband. They cannot ever be reused. Never. I know they say don't share dirty needles, but it's like, if it's only for you, people think it's okay. It is not okay. The blood starts to, ED particles start to like build up inside of it, and it becomes extremely dangerous to insert it back into your skin. Bacteria and such. So, do not reuse your needle. Bigger needle, boom, waistband. Put on your smaller needle. Since I only have one, I will set my thing down. Next, you need your alcohol swab. I use Curade because it was the only ones at Walmart. But you can also use rubbing alcohol and a cotton ball. Now, what you need to do, unwrap it, or put your thing on the cotton ball. This is how they look. And immediately, what you need to do now is choose which leg you are going to shoot it in. I will do this one. Let's see. I will do this one because I did this one last time. And you don't want to do it the same leg every time. You want to do back, forth, back, forth, back, forth, like every other time. So then you clean around the area that you are going to do. I do essentially my whole thigh, even though of course the needle won't do in the entire section. So when it's all clean and pretty, toss that away. Now I'm showing my leg, of course, to show you how this will work. Okay, this is the difficult part to show. The trick my doctor in particular taught me. Cap your needle, and then you grab your thigh. Let me see. I'm left-handed, so I need this. Well, actually, typically you want to put it in your non-dominant hand, believe it or not. Dominant hand has more strength to grip. So, you find your spot you want to put it. About middle thigh is the best spot. And put it to the side of your leg. So like it'd be over here. I'm just turning my leg to show you. You grip it tightly. You should feel muscle, not fat. And they do feel completely different. Muscle's a lot harder. If you feel your muscle, squeeze it as tight as you can. The tighter it is, the less pain you will feel when this needle goes in. It's a little trick we learned. Now, you insert your needle into the spot. Let me move down a little bit there. Now, if it hurts a little bit, that means you did not hit the muscle or did not grip enough. It's okay. Wait a second and try again. I'm going to switch hands, see if that helps any. It's all your own personal body. So I'm going to do right here. You stick the needle in. Quicker the better. And then you pull back a little bit. See if you get any blood in your needle. If you do not, then proceed to push it all in. Sometimes this hurts insanely. Patient. You will feel it running through your veins and stuff, and it hurts, usually. Doesn't always. Depends on if you hit a bad spot. So I hit a bad spot this time. But it's all, of course, practice. Keep going until it's completely in. Okay. Pull back your needle. If yours did bleed originally, then when you pull back, then find a new spot. Wipe that up, put a band-aid on or whatever, find a new spot. That means you hit a vein instead of the muscle. So now your needle, they say do not recap them when you throw them away, I guess to prove that they're used. I always recap, simply for my own safety. You drop it in your disposal kit, put that away. Now, you want to look at your leg, see if there's any blood. Sometimes, even when you pull it back and there's no blood, there will still be blood afterwards. I have no blood coming out, but always put a band-aid on. Simply because the spot is very sensitive to infection now, since there is an itty-bitty hole, even if we can't see the hole. So always put a band-aid on. I do the circle ones. You don't have to. Just a preference. And put it on the spot. Awesome. You're done. That's all it took. Your leg will be sore for the next few days. It will hurt. I'm sorry to say. It's a shot. Shots hurt. Mine typically is sore between 3 and 4 days. All depends on where you hit it, of course. And the more you use that muscle, the more shots you give, the more it will hurt. It's typically just a thing. Your muscle starts tightening up after each shot. So you're also supposed to put it in the back hips. They say do not do that yourself, though. No matter what, do not do it yourself, they say. If you're an expert, I'm sure you could do it. But they say always get a partner or a friend to do that. So I will not be showing you that on camera. Maybe next time. And of course, I only give one shot every 2 weeks, so I cannot be showing you now. So that was basically it. You got your shot. I got my nice band-aid on it. If you want to see how high it was up, that is essentially how high it is. I had rolled my boxers up, so if I roll them back down, yeah, so it's about right here. Usually you can do a little higher up, a little lower. Typically around this area you can do it. Don't do underneath your knee. Most of that is fat and not muscle. Some people say you can do it in your arms. I would not do that unless your doctor says you can. It is extremely rare, even for bodybuilders, to have enough muscle in their arms to be able to put the shot in. And it's also a movement thing. Use your arms more than you use your legs. So those muscles, do you want them to be sore? That's typically it. And if you have muscles in that spot, that means you use that spot a lot. So it's not as, yeah, it's just not as effective. You can use leg if you want. Typically these shots, depending on what type of medication you have, they take about 3 to 4 days to hit your system. So always do it when it's said to do it. And typically these shots, mine is once every 2 weeks. So my shot technically lasts, let's see, it would last about, so it's every other week, and it basically essentially lasts a week, exactly. When it first goes in, there's not really anything for a few days. Then it has the rest of the week, and then it has a little bit after you get your next shot. So I think it's 2 weeks. I'm not doing the math right in my head, but basically the shot lasts a little longer than it's supposed to last, so that it can give you the oomph until the other one kicks in. So your first shot, it will seem to take forever to kick in, but it'll be fine. It will be fine. I actually have another suggestion for people. I did not have to use them this time, but cotton swabs for your cotton swabs are cotton balls for your alcohol, or simply to clean up blood. These work way better than toilet paper. I've always wrapped up toilet paper and stuck it to it. These clean it up within seconds, and they're very, very absorbent. This is my brand advertising, I guess. It was the like 98-cent one at Walmart. So you don't have to use these. I rarely do. I think I've used maybe 2, because I really don't bleed much. I did a lot at the beginning, and then your thigh builds up the muscle and such. So I guess this will be my video. Remember to deposit it in your bin and clean up after yourself. Do not lose your things. Do not lose them. I have my Band-Aids and my alcohol swabs in one thing. I actually just got back from overseas, and so I had to bring, I couldn't bring the boxes. They wouldn't fit in my bag well. I had to do this. And if you were overseas, I understand the big fear. A lot of countries, you know, you have to show medical records to bring any shot overseas, or through any airport, even if you're just going to the town over. So it's a very scary thing. I thankfully was able to get mine through without showing any identification, because I packed it in my suitcase instead of my carry-on. But if you have insulin or something that you need more often, then definitely pack it in your carry-on. Since this is once every 2 weeks, I did not need it at that moment. I did not need it for another week. I was okay. Even if my baggage gets delayed, I still have a little bit. They say always put your medications in your carry-on, even if they're not everyday ones, in case your baggage gets lost. I actually had a bunch of my pills in my regular one that were daily pills, and my baggage got lost for a few days, so I did not have any medication that wise. But shots, not always the case. I keep my shot personally in this plastic bag it came in. It says to keep this bag, save this bag for shipping. Because typically you close the lid, then put it in this bag, and then put it in this really fancy box, biohazard box. Until I am done, to show myself it's not full, I stick the plastic down inside of it. I then, this is also a good space-saving idea for you guys. Okay, I'll show you how I pack it up. Okay, I then open the box completely, which is an obnoxious thing to do. Here's the inner box. This is for your actual needle. Okay, put it in, slide it in, your box. Then you slide that box inside of this box. Or you can just keep them in. I usually keep it in. Okay. Now a trick I use to save space, I get my shots and I put it in the plastic section that I dug a little hole for. As you get more shots, it's harder to fit in there. So I probably need to get mine dumped soon. Okay, put it in there. And then I get my needles and I put it all around it, like right here. And, you know, another one right here. Up here. And you will not ship it this way, of course. but it's easy for space saving. I started doing these when I went overseas. So you just put all your needles in. So there you go. Everything is in one place. Your band-aids and such. I have never put in this thing with them, but yeah, looks like I'm right. They can fit. All the pins, of course. Sometimes you want those out because everyday bruises and such, they happen. I'm going to choose to leave mine out. Now, every box, of course, is different. Mine closes by putting this one down first, then this one, and then this one with a 2 on it, and this one with a 3 on it, then this one with a 4 on it. Pull that back. This one goes down, and then that goes in. It is a very, very tightly sealed box. Mine came with the box. If yours does not, you will have to buy a box. At least in the US, you will. And that's another fee for you. What's good about the box, though, is if you buy it with the box, it comes with everything you need. You simply peel it off of these sections when you're completely full. You ship it in. You mail in your, basically you mail it in. They personally take care of it for you. You don't have to pay any extra fees like you would if you did not have a box. Because they make you get a box because it's the law. But this way, all done. It says big biohazard on it. You don't have to write anything on it or anything. You just put it in the mailbox or give it to the post office or whatever, UPS, and they ship it. Simple as that. It comes with the shipping label and everything. I don't know if yours will, but this brand comes with it. Everything you need. It says, return label for proper disposal and treatment. Okay, so this one is only available at the website or by calling the number. But it's okay. You still have a tracking document. And you have a section to slide it into. So this one is a little different. I guess that way they keep it updated. So if you've had this for years, you don't send it to the wrong location. That would be awful. So make sure you just have the right location. So, all packed up in a box, except for the Band-Aids and swabs and everything. But needles and everything else is in there. And see, it was easy. I say easy. I remember my first time I took over an hour getting the courage to prick myself. I still take a while to think, but because I've never been fond of needles. But once you get the hang of it, boom. Few minute thing. It does, as you look at the time. I was talking through it, but I would still say give yourself at least 15 minutes. If you're really good at it, it may take less, but likely will take more, so maybe 20 minutes, 25. Especially during your beginning, you may want to give yourself a full hour. So if you have any plans, make sure to do it after that. These can be done, mine can be done in the morning or at night, anytime. Some people have a certain time they have to have it done. Mine does not, so I can simply, and it does not have to be the same time every time. A lot of medications, that's insanely important. If you take it in the morning, the next time you take it better be the morning. Most intermuscular ones do not have a time thing, though. They'll say, take it this day. I mean, maybe you take it at 10 one time, the other time you take it at 3. I mean, it's just, take it that day. That's basically the only real rule there. Because as I said, it does stay in your system for a little longer than that. So in case of emergency, absolute emergency, you can put it in the day after, but I would try to do as early as you could that day after. This is, again, all your doctors. I do not want to, if your doctor tells you something and I'm contradicting it, follow your doctor. This is what my doctor taught me. This is what I've seen a lot online. If your doctor told you, like, never do something that I did, then don't do it. This works for me, does not work for everyone, and your doctor knows you best. Simply because they're a trained professional. They have a lot of experience with their own patients. I may have seen maybe 10 articles. They may know hundreds of patients they did this for. So theirs is likely more effective. But, this is my advice to you. It's a simple thing. I know I was taught how to do it, and I completely forgot by the time my next shot was due, so I had to look these up again. And I went back to them and everything. They re-taught me and everything, and it was the same thing. So, it's okay if you forget. Just now, my leg is starting to have a little bit of blood behind the Band-Aid. I don't know if you can tell, a little bit of coloration. So it's just now starting to bleed. It wasn't bleeding earlier. Which is why I say always put on a Band-Aid. Even if it doesn't bleed immediately, it probably will. And there's still the infection thing. So, very, very important. If you mess up and you're bleeding really bad afterwards, because it means you hit the wrong spot, don't panic, okay? It's happened to me millions of times. It still works just as well. I would not choose that spot. Like, definitely aim for the muscle. But if you miss, you're not going to die. Nothing's bad's going to happen. It may get out of your system a little faster. So it's definitely not recommended because there's blood loss and everything else. More risk of infection if you hit the blood. And clotting and everything else. But you will not die if you do it a few times. Don't aim to do it, as I said. But if it's an accident, it's an accident. Do better next time. Just try to pull back trick. I have never pulled back and had blood with the needle. But almost always it's been bleeding. I mean, like, my first 2 times it was bleeding awfully afterwards. So, I don't know why the pullback needle thing. I've never had blood show up. Maybe it does usually. Maybe it doesn't. I don't know. That's what my doctor taught me to do. So, I don't think it's very effective. But maybe if I pulled up blood, it'd be a really bad sign or something, as opposed to just a moderate bad sign. I don't know. But these are my advice to give to you guys. Simple thing. I keep them all together. I keep them in their own spot, away from reach of children or pets. And it's just that simple. It just becomes second nature to me. And I know how much I needed help when I first started. So I'm helping out with you guys. Whether you're a concerned parent, a person who's doing it themselves, maybe you're just curious. Maybe you're going into nursing and you want to figure out how to give them. They will, of course, teach you how to give them, but this is a good way to start if you're really curious and want to learn really fast. As I said, of course, don't take my words as law. Always go with your doctor said, or your teacher. But if your teacher contradicts your doctor, go with the doctor. I mean, teachers may be more aware, but not as much as the doctor. That includes nurses. You know, maybe the doctor didn't teach you how to give a shot, but your nurse did. Okay. They're definitely more trained than anyone else, other than, of course, the doctor. A lot of times nurses are better trained than doctors, because doctors will diagnose the issue and everything, while nurses are the ones that collect the blood and give you the shots and such. So, it's essentially what you had in your environment. Most people will have a doctor or a nurse. Usually you have to have a doctor prescribe medication that's intramuscular, but you don't always have to have a doctor renew it. It depends, of course, on your area and your doctor and everything else. A lot of places will not even let you keep the intramuscular shots. You will have to come in once every 2 weeks or whenever it is, get your shot, and you pay for them to do your shot. Sometimes they have free shot clinics, whatever. But you cannot take it home. Very inconvenient, and costs money in most cases. You have to take your whole day out to go to the doctor and blah, blah, blah. Like, it's not something that you can just do during lunch break. So, it's much more convenient this way. You can do it any time of the day. You don't have to worry about the hours of the doctor. So if you have a choice, I would definitely do this. But if you don't have a choice, then, I mean, it's whatever your place does. All states have different laws. This is Texas law. So, if, let's say, Arkansas had a completely different law, then follow your law. Don't break the law. Just do whatever your doctor says. If your doctor says break the law, question your doctor. But, this is what I'm here to teach you guys. So that was how to give an intermuscular shot of any kind. Mine was testosterone. So if you're curious or wondering why it was that color, most will be a weird yellowish color, but some may not. All depends on your medication. So, simple as that. You can pull back on your pants, you can pull back down your shorts. Boom, you are done. You are great, and you are done for the next few hours, few weeks, few whatever. Whenever you have to do it. So, I hope you guys learned something here, and I hope I was helpful. TFCom, signing off. Bye.